And we're live.
All right, we are back live. That was quick. A short break. So, Tina, do you want to introduce
Sure.
Dominic for us?
sit here and just do it from here and then he can go.
Yeah, both of you come up. If you want three up,
You
that's
can
fine.
sit in the big,
The big chair.
big chair and I'll just be your assistant.
Increase. And so we're going to start with an introduction to the three of you who are here. Well, first we'll introduce ourselves and then we'll have the three of you introduce yourselves both.
Senator Larry from Orange County. Through the woods. That's the easy way to get there.
Sam Douglas from Orleans County.
Jenny Lyons from Chittenden Southeast. I used to represent Milton, but they took it away from me. It's bad.
Bring part of that.
Senator Martine Rockmuller. I live in Burlington and represent Chittenden Central.
And Providence right here in Washington District.
Manaz Mawani. I work with UVM as a postdoctoral scientist.
But you're a PhD researcher, right?
I'm a PhD researcher. I work on cardiovascular diseases and I was a nurse. I used to work in cardiac ICU, saving lives in hospitals. And then now my research is all about cardiovascular diseases and improving outcomes of cardiovascular.
Thank you.
Dominic Barkham, I'm a sophomore at Milton High School.
So he's so underselling himself, but I think I'm Tina Zook. I'm the government relations director for the American Heart Association, and we are promoting legislation that would require cardiac emergency response plans in schools, so we'll have better outcomes when somebody has a cardiac arrest. So right now it's only 10%. What I just discovered this week, that's the national survival rate. Vermont's less than that, 7.5%. So Dominic is kind of a miracle, because Dominic had a cardiac arrest on January 2nd, but it's followed in 3rd. So
January 3rd.
January 3rd.
Wow, that was not too long ago.
It's
And look at you.
He's from Milton, and so I'm very happy he's here, but I want to let him tell this story because it's an awesome story. I'm grateful.
So on January 3rd, it was coming right after Christmas break, New Year's break. We had a game against Spalding, and everything was fine the night before to leading up to the game until I got we were all in the locker room getting ready, warming up. Everything was fine until I got put into the game. I got put into the game. I'm fine for the first 2 minutes of the game that I'm in. And once I get the ball, I make a pass to my teammate, and just out of nowhere, my vision went blurry. I was just quite blurry. And after that, I ran over to my coach and was like, I need, take me out. I need to get some water. And then next thing I know, I'm waking up from doctors and hospital people surrounding me, trying to, bring me back to life. And they, at first, the athletic trainer, she was doing CPR, and she got me back for a little bit, and then right after that, I went back out, and I don't remember that. That's just what I was told. And then she was able to get the defibrillator and shock me back to life, which was, not a miracle. And now I wake up, I'm trying to find doctors, trying to make sure I'm okay, make sure I'm, they're not just, kind of conscious and not knowing what's happening. So they give me the IV, they take me out to the stretcher and bring me to the hospital closest to Spalding. I forget what it's called. And so yeah, they take me there. I'm there for a little bit. They're making sure I got just making sure I'm healthy and stuff. And I'm there for a few hours. All my parents, guardians coming out to see me because they heard what happened. And then they, at 9 p.m., they ended up taking me to Boston. Driving to Boston.
How did you get to Boston?
They drove me. They said they were going to get help. I was originally supposed to go to MDU or UVM,
UVM, yeah.
but they said UVM is not as, you know, whatever, not as,
Yeah.
not as like
Set up.
talented.
Yeah.
And they were also like kind of full. So they took me to Boston by driving me, which was like a 3.5 hour drive. And so we get there, go out to my room. And well, feels like not like I feel fine. I feel fine, and like there wasn't much that I felt different other than like knowing I'm there, and it's just I was sitting there doing almost nothing. Like
Yeah,
there's nothing I could do.
you felt good.
Yeah, I did feel good.
Good to be
That's
alive.
good to hear. Good to hear. How long did you stay in Boston?
A week.
When did you get?
I got in Boston. Oh, I got a defibrillator and a pacemaker right here on my chest.
Yeah. Oh, wow.
Yeah.
Oh, they actually did?
Yeah.
Yeah. Wow.
Um,
Were you at Mass General or
so,
which hospital?
Boston Children's Hospital.
Boston Children's.
Yes.
Good hospital.
Yeah.
That would be the place.
But yeah, so I was there for a week, and then I was able to come back home and try to live my life, my normal life again. And
Go ahead.
Thanks for being here today and sharing your story.
thank you for having me.
It's really compelling and so glad that you are here to tell the story. Yeah, I was gonna say, so Spalding obviously had a defibrillator at the school. Do we know what percentage of Vermont schools actually have them in the buildings?
Yeah, so generally we do, so the health department requires anybody who has an AED to register with them. Schools included, so there are 211 schools or school districts who have registered, so a lot. And so maybe more schools than that, since some of those are districts that register. I always forget the number of schools because I feel like it's fluid depending on what schools you're talking about, 300-ish or so. We worked with the UVM Medical Center, Lerner College of Medicine students on a public health project to survey schools to try to find out more of this. 160 schools actually responded to their survey, but every single one of them that responded had an AED, which is really great. But maybe that's why they responded to, and I don't know why the other ones, maybe they didn't, I don't know. But we did also say, do you have a cardiac emergency response plan as part of that survey? And 84 schools said they did. So that's heartening, but it's not all schools. And I don't know exactly what they consider like a plan. So we want to make sure the plan has all the right elements, but Spalding did. And look, this is great.
Well, they're close enough to us in this building that they might have heard what's going on. I'm sorry.
I was just gonna say, who was the person who administered the CPR and then the AED?
Ashley like Morris.
Was she the school nurse or?
She was the athletic trainer, and she
Wow.
helps with like just all the teams.
Wow, so there's three. So there's an athletic trainer and then two coaches at
Oh
Spalding.
yeah, all I know is
Because he
Right.
I was
was in the middle of it.
Experience,
And from what I understand, there were two coaches, not the actual coach of the team that was playing, but there was another basketball coach and a wrestling coach who did the CPR together. And I talked to the fire chief who came, and Dominic was revived before wrestling came. Just because
Remind us, so the bill for the CPR, for the plan, the cardiac response plan, I have asked to have it here this week. We don't have it yet, but it'll be introduced very soon. And so the cardiac response plan, you're saying is in 84 schools. Remind us, what's the situation now with CPR training? Do we have, where is that?
Yeah,
in school
So
right
the only thing that's required in schools in terms of CPR training, 11 years ago, this legislature passed a law that said, we had a little something to do with it, that had hands-only CPR instruction required to be part of comprehensive health education curriculum that's taught to all students. We had wanted it to be a graduation requirement. That's pretty close. So that's hands-only. So that just means no rescue breaths are required, and anybody can learn it and should learn it.
Yeah.
This committee hasn't learned it, should. But so there's that requirement, that's the only law, really, the nurses and PE teachers are required to be CPR trained as part of their licensure. And the Principals Association requires any paid coach to be trained in hands-on CPR.
Yes, and I know that counselors who are in school also get CPR training on a regular basis. That's good.
So it shouldn't be a big lift, there are some who are trained.
Yeah.
But, you know, and we could talk to you when the bill's here, you know, so I won't go into detail, but, a lot of schools have a nurse that might be trained, but may or may not be there the whole week. And they don't want Dominic's case at the event at his school. And the nurses are Tuesday, Thursday, and she's not there and this happened. The people wring their hands and wonder who's CPR trained and where the AED is and what to do. Then, so this legislation would make sure there's a team that's trained. The AEDs aren't just hanging on the wall, but there's drills that are done. So people can, no problem, jump into action instead of freaking out and not, no, I don't know how to do CPR, do you know how to CPR and that kind of thing. And then, you know, that the AED isn't locked inside the building if there's sports going on after school. We need an AED, and that has happened.
Mobile AED.
Many of the teams have AEDs that go with them.
Yeah. Cool. So, let me ask you a question. So since this happened to you, do you think your schools become more interested in at Milton? Do you think people now understand the need for plan or do you see any changes around you?
Yeah, my nurse has been, like my nurse got the license to be able to train people to learn CPR, and like my entire school is trying to just make sure everyone's safe and that it doesn't happen to anyone like anywhere else, and just wants to make sure that they can prevent anyways.
You don't want this to happen again.
Yeah.
And as an update, and one reason we're grateful for you all is last year, you approved funding, it's a small amount, but to provide hands-on CPR kits to schools so we could help implement that hands-on CPR law. And we asked the Principals Association, what schools do you think would need it the most? And they gave us a list. Coincidentally, Milton and Spalding are both on that list. And so they're finishing their game that they didn't get to finish on January 3rd, this coming Monday. And we will provide those kits to schools at the game, which is cool. So because CPR will be top of mind for both schools, many students what happened. So
Are you in the game? Are you going to be able to play the game? You're going to sit on the bench with them?
Yes.
Okay. Well,
That's important.
we'll be a strong inspiration.
That's great.
Yeah.
Are they all wearing your number?
I think they're gonna have like a ribbon, like a pin with my number on it, but I'm not fully sure yet, but I think that's what's happening.
What number?
20. I'm wearing my shirt that someone made for me actually right now. Oh, yeah.
Oh, yeah. I like
Of
that.
course.
That's nice.
Right.
Yeah. Good. You can stand up and take a look.
So it's time.
We have this.
So I got the bracelet that says $23.
Nice.
It says our heart hero.
Nice.
On the back, it says,
Oh,
Oh, wow. Awesome.
that's awesome.
Nice.
That's nice.
One of the Spalding moms, a player who is playing against Dominic, wanted to do more. So
She did that?
She's doing the t-shirts too.
Now if they do it, all they have to do is lose to Milton.
Maybe they were going
Those are my.
We already love them. We already love them.
I don't know why they haven't recruited my grandson. He's only 6'3". Well, unfortunately, our time is getting short, but I can't tell you how much we appreciate your coming in and talking with us. It does our heart good to know that your heart is better.
Thanks, Tom. Thank you.
Thank you.
Thank you.
thank you.
Okay.
My wife.
You find out who that is by talking.
Tell her to come to the game on Monday,
Get it.
7 o'clock.
Thank you.
Thank you.
Thank you. Thanks for coming in. Oh, we have, Lauren Bode. Is it Bode or Bodie? Come on up and, we have a few minutes here. We're always crunched in here. But we would like to hear from you as the Vermont Pharmacists Association. Yes, sir.
May I take photos of,
Oh, yeah.
this morning?
Yeah, this is a photo room.
Yeah, thank you so much, Madam Chair, for having me here today. So my name is Lauren Bodie. I'm the legislative liaison for the Vermont Pharmacists Association. And I just am delighted to be back in the building for another season. So my intent today is just sort of introduce to the resource that we have in our Vermont pharmacists, answer any questions that you all have. So I would like to start off by saying that I am a pharmacist who does not touch any medication. And often when I tell people this, they're flummoxed. And so I'll explain. So I went to 4 years of undergrad, 4 years of a clinical doctorate, 2 years of postgraduate residency training. And I'll tell you, I didn't need to be taught how to put medications in a bottle. That's something I know. What I was taught over those 10 years of residency or education and training is how to choose the medication and how to care for the person who is taking it. And so what I do now is I help people in a clinic setting, not in a pharmacy setting. And that's how I personally am a pharmacist. And so similarly, the value of a community pharmacy is not wholly encompassed by the medication that it dispenses. The true value of a pharmacy is in that highly trained doctorate level pharmacist. And we know from literally hundreds of studies that when a pharmacist becomes more involved in a patient's care, 4 things happen. Treatment outcomes improve, patients are happier with their care, and the care costs the system less, and other healthcare providers, their stress goes down. So there are many challenges facing our healthcare system nationally and here in the state. I know you guys have been devoting a lot of energy to talking about some of those. And so I'm really here today to urge you to remember that pharmacists can be a part of the solution to the problems we're facing if given the tools. Pharmacists are trained to treat minor ailments, manage chronic diseases like high blood pressure and diabetes. We're a trusted source of health information in a time where that's becoming increasingly difficult and chaotic to access. And so as we are helping address the health of Vermonters, we also ask that you help us address our own professional health. We're losing community pharmacies at a truly alarming rate. And this is due to many factors, but really isolating squarely on what continue to be the predatory practice of pharmacy benefit managers. And then in addition, the pressures common to any business operating, whether inflationary or staffing. And when a pharmacy closes, we're not just losing a place where you can buy shampoo conveniently. We're losing a cornerstone of our health access. And it's a place to we're losing a place to get medications, vaccines, a blood pressure check, and advice. And you're losing that in an accessible way. You're losing all of that, in a way that, you can get that sooner than you can get a call back from the primary care office. And this is only if you're one of those Vermonters that's lucky enough to have a primary care provider. So while the challenges that we're facing are great, I am absolutely confident of our ability to overcome them. In particular, we are working together across the system, across the professions, to really invest in the healthcare infrastructure. And our community pharmacies are a part of that healthcare infrastructure that we have in the state. So I welcome your questions and thank you again for the opportunity to come and introduce us.
No, thank you. This is actually a different perspective that we haven't heard recently about pharmacists, and very welcome. Thank you.
Yeah.
Go ahead. I hate to say I told you so, but I think it was 20 years ago. It's not just the PBMs, it's all the online pharmacies were actively, I had a friend who got put on a blood thinner, coworker. And they were just seeing if it worked. So he went in, got the prescription. He said before he got home, he walked in the door, the phone's ringing, and it's an online pharmacy saying, you know, we can get that for you cheaper.
Yeah.
And so they have taken out working to take out all the maintenance drugs, which I'm assuming is your bread and butter. The stuff would come in every week. I just picked up two, every month or so, and you pick up your maintenance drugs. And so you're just left with the emergency antibiotics. And then you've got the PBMs playing games with numbers and all kinds of other stuff. But the Sugar Bush Valley has no pharmacy.
Right.
Walgreens just closed in Montpelier.
Yeah.
And you can go to Kenny's now, and I've switched my prescriptions there, but you can't buy shampoo in any variety there. You know, it's, and we used to have at least 3 pharmacies. One was private. Two of my daughters worked there. And that was just the pharmacist who wanted to be a pharmacist, but had to sell shampoo in order to break even.
Yeah. And shampoo isn't enough anymore.
No,
Not with the way things have been.
not gonna happen. No, and I'm
Yeah.
not sure how we change that. Because you're right, there is a value to having someone local where you get your flu shots, your COVID shots, your RSV shot.
Got to do
Well,
that.
I just
I have that
want to circle back to what you said initially and how important you are within the healthcare team as part of the team. And I completely understand what you said. It really hit target with me. I have close relatives who have severe chronic illnesses, and the pharmacist is integral to helping them when they need their medications or comments about medications. So, so thank you, for bringing that perspective in, because it's really important for you. And our time is up. We're being deep.
And-
I'm sorry. It
No,
was great to have you in.
No, my hope is that this is an initial conversation and that whenever there is anything, primary care focused, public health focused, of course, pharmacy specific, please do reach out to us. We want to be connectors. We want to be advocates. We are here to support the health of Vermont. So please
Be
do reach
careful
out.
what you wish for.
I know. Sitting here in my
We will do
volunteer
that.
position.
We've got legislation we can plug